Good morning, everyone, and welcome to Lewisham and Greenwich NHS Trust. My name is Elaine Daly. I'm a clinical skills practitioner here at Woolwich, and welcome to your induction. I'll just bring up my slides. So welcome to Lewisham and Greenwich if you've not been here before. So we are two sites, one trust. So we have Queen Elizabeth Hospital on Woolwich site and Stadium Road, and Lewisham Hospital on Lewisham High Street. But we come under one management team, so you'll have one undergrad team looking after you for both sites. So our trust vision is to work together to provide high quality care for every patient every day, and that does count for you guys as well. Being part of our team, you buy into this vision and you are part of it, and we expect you to adhere to our standards of care and patient delivery. These are our values. We are to treat everyone with respect. These won't be any different values you will have been told about in any other trust. Most trusts tend to work very along similar lines. We work as a team and we take responsibility for our actions, particularly at this moment in time. That's very pertinent and very, especially with COVID around, and it's still quite impactful within both of our hospital sites. With that in mind, we are still expected to socially distance. We are still expected to wear scrubs whilst in clinical environments. So you can save your ironing, you can come in wearing whatever you want, you will change into scrubs. You must make sure you have valid ID on you. And also I will ask you that you dispose of your scrubs correctly. We have had lots of instances over the last few months where dirty scrubs have been dumped in the student areas, and it's unacceptable, especially with the high levels of infection that are prevalent around at the moment. And so, yep, you're wearing scrubs for all clinical wear. There are masks and sanitizers for you to use at all hospital entrances and everywhere, and thankfully plenty of PPE, not like the first wave where we didn't have very much. There are plenty of PPE, so please use it. Masks are mandatory still on site. I know that the society as a whole seems to deem it less necessary to wear masks in areas, but we still expect that as a mandatory undertaking. We expect you to do lateral flow tests twice weekly. We will provide you with those lateral flow kits. You get a box of them. Show you here a box of them with about 25 in, and there is a hospital site where you have to input your twice weekly tests. Vaccines, we have started rolling out our booster programme. So if it has been 6 months, 180 days since your second vaccine, then you will be able to get your booster vaccine whilst on site here. It's the Pfizer vaccine for the third one, so it doesn't matter what you had for the first two, you will receive the Pfizer for your third vaccine. Oh, you can also get your flu vaccine as well at the same time. That's always a joy when you're trying to sleep and you've had both arms stabbed. As I say, a nod to PPE, there are signs everywhere. What's appropriate PPE? So as a standard, it's apron, gloves, visor, mask. And if you're around anyone with aerosol generating procedures, so if you're in ITU with COVID positive patients or and respiratory wards with CPAP going on, or anything aerosol generating, you are expected to wear a full PPE. This is the organogram for medical education under which we sit. So we are the green team down the middle. If you have any issues with us, you need to see the people in red because they're our bosses. But yes, you're more than welcome to come to any of us, and we will hopefully we will help you as much as we can. Sorry. Speaking of the QE team to start with, let me just move my face down a bit. So the QE team is Mr. Yu. If you have been to QE in your previous years, you will know Mr. Yu. He is the current undergraduate sub-dean at Queen Elizabeth Hospital, and he's been here for ever and a day. So if there's nothing, if you ask him and he doesn't know, we've never come across it before. Katie is our undergraduate administrative lead over both sides, but she's based predominantly at Queen Elizabeth, and Jo works with her as well, Jo Christine. Holly, unfortunately, has now left us. I haven't updated the slides, I do apologise. But we have Sam Checker, who is our clinical teaching fellow for Queen Elizabeth Hospital. And that's a photo of me with my hair done. The Lewisham team. My slide has froze. There we go. The Lewisham team. Mr. Bird is the current undergraduate sub-dean for Lewisham. He's an orthopaedic surgeon over there, and he's been an undergraduate sub-dean for a long while as well, and is very approachable and will help with any of your needs. Nor is my counterpart over at Lewisham. He's the clinical skills practitioner, and again, if you've been here before, you know Nor very well, and he and I will help you with any teaching that you wish to have. Han is the clinical teaching fellow over at Lewisham, and she started a few weeks back, so she will be raring to go and do some education stuff with you as well. And Rory is your undergraduate administrator over at Lewisham, and again, he's based at the Education Centre, so if you need anything at all, you can go and see him. So general stuff that applies to both sites. As I said, you will be in scrubs for the duration of your clinical time for the foreseeable future. So do make sure that you get a clean set of scrubs every morning. Whilst here, you will receive IT logins. If you have been here previously, your old IT login your username will be the same, but we'll probably just need to reset your password. But you should receive your IT logins within your first week. You have two forms of ID. So you'll have your smart card and your ID badge. Your ID badge is your photographic ID that you have here, and it also doubles as your security access to the sites. If you have been here previously, please bring your ID badge in, and we will just update it for the site that you're on. If not, we'll get you one on your first clinical day. Your smart card is your access. We are a paperless trust, so you will need your smart card to access any patient data. You may have had a smart card in previous trusts, and please bring that along because we can just update it to our spine. You don't need a new smart card for our site. We use the old ones. Our attendance register, Kings are asking for us to make sure we are reporting back to them about your attendance. We use an attendance register called CAPQR. You will have logged on to this already to access your e-learning. So make sure you've got it, because on Katie's and Rory's desks every morning, you'll need to come in and scan the QR code. So it doesn't need to be every morning, at least once in the day. If you are running late and you need to get to clinical, that's absolutely fine. Just make sure you come up at some point in the day. If you are sick, that's absolutely fine. Just let us know so that we can update the attendance register accordingly. As I say, we are paperless trusts for most areas. The only area that's not paperless and is still old school notes is paediatrics, and that's mainly down to the pharmacy portion, because paediatrics have very specific, depending on their weights, their volumes of drugs that they have. So because of that, they haven't quite worked out the quirks. So that's still old school handwriting. Everywhere else is paperless. There is a free shuttle bus that moves between QE and Lewisham that you're more than welcome to use. Just make sure you have your ID badge on. It runs every hour from 7:30 till 6 o'clock at night. The only times that you probably need to book it is the one in the morning, so the 8 o'clock in the morning, and sort of the 5 o'clock, 4 or 5 o'clock at night one. We will set up WhatsApp groups for you all so that we're able to let you know of last minute cancellations of teaching or updates to rooms. You can also use that to let each other know if there's something interesting going on, you know, the chest drain going in room 4, so that you can help your colleagues as well. I will please, our personal phones are on that, so I will ask you to, one, keep it professional, please, and also if you're texting at 10 o'clock on a Sunday evening asking what's going on the next day, you're not going to get if you do get a reply, it won't be a nice one, or if you get a reply at all. If you need to know what's going on the following week, please just be a bit proactive and find out the week before. So we will answer messages during normal working hours, but please be mindful that that is our own personal phones on there as well. So you can claim travel back for QE. Lewisham is classed as a hub site, so you can't claim travel back for any placements based at Lewisham, but you can for QE. If you are in receipt of an NHS bursary, you have to claim this back through the NHS bursary website. If you don't claim an NHS bursary, you can claim this back, but it has to go through King's. So hopefully your timetables will be out to you. If not this week, then early part of next week. But no, you start next week. So we will have the timetables out to you by this week. Please look through them. If you have any questions, then please come back to myself or Katie, and we will endeavour to answer your queries. You should already have your educational supervisor and have already met with them as part of block 1, but we do please make sure that you are meeting with them regularly throughout the block. So you will have an end of block meeting with them to get your sign-offs, but do keep in touch with them because they will help you if you have any issues and you don't feel like you come to us. You will have an allocated clinical supervisor. They are defaulted as your block lead unless we tell you anything different. So for instance, Dr. Ohanusi, he will be for your EMCC block, will be your block lead. Whereas some other areas we do split them out, but if we haven't given you a specific clinical supervisor, it's your default block lead. Teaching, we have regular teaching, so EMCC, you have your teaching on Tuesday afternoons. At QE, Lewisham, it's sporadic throughout the week for EMCC. Women's health, you will have teaching ad hoc, depending on when the clinicians are available. And child health, you have regular teaching with Dr. Kears and Dr. Raj at your respective sites. Invariably, we are very busy. Winter pressures, I think, started in June and haven't let up at all. So both hospital sites are extraordinarily busy. Clinicians do have to cancel teaching last minute. We try and keep this to a minimum, but it will happen. We will reschedule if possible. If it's cancelled and we don't know about it, then please let us know and we can reschedule it or try and find out what's going on. But please communicate with us. Specifics for Lewisham Hospital, you will have lockers. It's based in the education centre. At the moment, and you have a kitchen there as well in the education centre as you walk in. It's the large kitchen in the main area of the education centre. Unfortunately, at the moment, that area used to be for students as well, but the less of theatre, the less of lecture theatre, which is in that same building, is currently our immunisation centre. They're only immunising Friday to Monday at the moment, so Tuesday to Thursday, that area will be quieter, but on Fridays and Mondays it does get quite busy in there. You're still able to use it, it's still your area, just be mindful there are staff and patients coming in for their vaccines. You have computers in the education centre specifically for your use. You have ones up in your student area, but also you can use the computers within the library area as well. Your student space is small upstairs in the education centre. Like, you can't really have a huge amount of people up there, so do be mindful about social distancing and making sure that if there is a lot of people in there, that you vacate the area if you're not needing to be in there at that point in time. The student space as well, please do not dump any scrubs in there. We have had lots of issues over at Lewisham with people dumping their scrubs. There were linen bags in there, but people weren't using them. If there are no linen bags up there for you to use, then you must take them back to a clinical area on your way home. The library is open 9 till 5. The staff in there are amazing. They will help you with anything you need. It's a nice quiet space, but it's not out of hours use at the moment due to COVID and staff restrictions. We have a clinical skills lab in the Owen Centre that is just for student use. If it's not in use for teaching, then you are more than welcome to use it, but please liaise with Rory and Noor to see if anyone is using it for the time that you need. Food and drink, you're quite lucky over at Lewisham. You've got the canteen, you've got muffin break, you've got the bakery just next door, you've got Subway across the road, you've got Lewisham High Street, mere 5-minute walk away. So yeah, you are lucky over there. Not so lucky over at QE, we don't have as much food options here. But we do have lockers. Our lockers are on the 9th floor of St Nick's Tower. Your student space is up there as well. It doesn't have a kitchen, but we buy into the doctor's mess, which is literally next door to your student space. And they have fridges, sinks, microwaves that you are more than welcome to use. Do please be mindful, though, that it's the doctor's mess. If they're up there, they can be working. So just be mindful of the noise you make and the mess you leave. There are computers in your student area. There are 3 computers up there that you're more than welcome to use. There are computers in the doctor's mess area as well, but again, the doctors might be using it for work-related activity. The student space up there is quite small as well. There are linen bags up there and they do get cleared. Please don't overfill the linen bags as well. If you half fill them, knot them up and then use another one. Again, no leaving dirty scrubs lying around. It's just not sanitary. The library is in the education centre, and again, it's 9 to 5. Again, it's huge. There's loads of computers in there that you're more than welcome to use, but it's a nice quiet space for you to work too. We don't have a dedicated clinical skills lab. The skills lab that's in the education centre is used by lots of teams. You are still more than welcome to book it. It's just space-wise. Sometimes I've booked space in there. So if you do want to use the clinical skills lab for any private teaching, ask me and I'll see if there's any rooms, if there's any times that I'm not using it that you can. We have the laparoscopic lab as well. That is kind of, we've acquired it, and that is a student space. There is lots of teaching that we use in there, but that's a space that you guys can use as well for some private study or private OSCE practice, etc. But please ask Katie or myself to see if it's currently in use. Food and drink, you have got the canteen, there's a coffee shop, there's a Starbucks down there as well. Costa, I can't remember. There's a coffee chain down there. We don't really have anything out at Woolwich. Is about a 15-minute walk if you need to go and get food. There's lots of food options down there. Uber Eats always delivered though, so you can definitely access food that way. So what you can expect from us, we will endeavour to communicate with you. The biggest frustration we know, and from our point of view as well, is cancelled teaching. We try and minimise this as much as we can, but things happen. What we can definitely ensure is that as soon as we know, we will let you know. We will communicate timetables, we will be approachable for you. Please come and see us if there are any issues. Please don't leave it until 2 days before the end of your placement, because we're never going to be able to help or sort anything out in time for you to leave. So please let us know early if there are issues. What we expect from you, we expect you to turn up. We expect you to attend. We know if you're sick, that's absolutely fine, but please make it every effort to come in, particularly you guys at QE. There is only 6 of you. If you decide you can't be bothered to come in for teaching or for clinical that day, it's really hard when we ask clinicians to come to teach. A couple of you missing is really obvious. It's disheartening for clinicians when there's only a few of you in for teaching when they've given up an hour of their own time. Most clinicians don't get the PA time that requires them to do all the teaching that they need. They do it in their own time or over lunch breaks and stuff. So please turn up when you're expected to turn up for teaching. And that's it. We do expect you to enjoy yourself. We are 2 small trusts, but the good thing about that is you do get a lot of experience. You do get a lot of hands-on time. The teams are really good at including you and doing as much teaching, bedside teaching, as possible. They are, one thing we do very well is including you and being part of the team. So I hope you do enjoy it. The undergrad team are here. If there is any problems at all, please come to us and we can endeavour to sort it out, or we will flag it or raise it if it's a higher issue. But enjoy yourself, and I look forward to seeing you around. Bye-bye.